Welcome to my life. Our topic here is today is a traditional eye medicine. Okay. What I've realized is that so many patients. Hello, this is cataract surgeon Heidi here. I'm cataract surgeon Heidi. Welcome to my life. What I've realized is that traditional eye medicine involves natural products like herbal extracts. You know, sometimes so many people use traditional eye medicine. Sometimes you don't know traditional eye medicines have toxic products in it. So when you are using it for your eyes, it would destroy. There is a glass on your eye called the cornea. This cornea can okay. Hello, animal marvel. Welcome to my life, and I'm trying to teach on traditional eye medicine. People are overusing these herbs in their eyes. Welcome, animal marvel. Where are you watching from? Where are you watching from? Like, subscribe, and share. Yes, as I was saying, I said today I'm going to be talking on the traditional eye medicine because so many people, especially in the bush, they're watching from Dubai. Animal marvel, where? Thank you for joining my life. You're watching from Dubai. Thank you. Yes, as I was saying, I said traditional eye medicine. Traditional eye medicine is common in our local society here. This is Surgeon Heidi here. Traditional eye medicine is common here, around here. And that's why I chose to talk on that topic because so many people don't know they have a cornea. There is a part on the eye known as the cornea. Joshua Alexander, welcome. Hi, Joshua Alexander, welcome. Where are you watching from? Hello, Joshua Alexander. Welcome. Raji G, welcome. Rajek G. Welcome, Rajek G. Where are you watching from? Thank you for joining my live. Rajek G, welcome. Please like and subscribe to my channel. Thank you, Joshua Alexander. Joshua Alexander says I subscribe. Thank you very much. Thank you for promoting my channel. Thank you very much. As I was talking on traditional eye medicine, the eye has a part known as the cornea. The cornea is like a glass of your eye. It easily melts. Rajiv Jill say, I love you. I love you too, Rajiv. I love you too. Thank you. Welcome to my life. And then Joshua say, I have go. I've not understood your English. Okay, thank you for subscribing, Joshua. Thank you for subscribing. So what I was saying is that the eye has a glass. When I'm talking about traditional eye medicine, I mean that we are in a local community, and people just put just anything in their eye. It's because they don't know they have a cornea. They don't know they have a cornea. And myself, before I went into ophthalmology, because the study of the eye is ophthalmology. He said, I love you. I love you too, Joshua. Joshua, I love you. Thank you very much. So before I went into ophthalmology, I didn't know I had a cornea. So when I was growing, let me tell you a sweet story. When I was growing, My grandmother came to live with us for some time, and she used to grind these herbs, leaves. She used to grind leaves, put in small plantain leaf, and in the morning she would drop it in my eyes. Oh my God. I didn't know it was bad until now that I joined the eye department. And you know that fresh leaves contain fungus. And fungus is something that when it affects your eye, it cannot be treated. I will share some photos after my life, I'll try to share some photos on my channel. You see, there is one of my videos I showed on fungal corneal ulcer. It is very difficult, especially in Africa, to treat fungal corneal ulcers. And they are common here in Africa. They are common in Africa. So fungal corneal ulcers are very common in Africa. Because when they go to the farms, people go to the farms, and then maybe a foreign body, you could be working on the farm and a foreign body jumps into your eyes, and the first thing is we start blowing with the mouth. What you should do is to wash with much water. Wash with water and then rush to the hospital. Don't put anything inside. Here they will start, maybe something enters the eye. The first thing, let me tell you, the first thing is they will rub. When something enters the eye, they rub the eye. When a foreign body enters your eye, don't rub the eye. Don't rub. When something jumps in your eye, you feel that there's a foreign body in your eye, what you should do is just close your eyes. You'll be tearing. You look for where there's clean water. You wash the eye. After washing your eye, you rush to the hospital. Don't start looking for grass to pick the foreign body. I was talking about herbal extracts of traditional eye medicine. Because the people who just came, I started talking about traditional eye medicine. We have a cornea. The cornea is like a glass window on your eye. It can easily be destroyed. How? Because when you put it, sometimes some of those products are a bit acidic. Some of the products are a bit acidic, and when you put them in your eye, it starts melting the cornea. Don't let somebody put anything in your eye. Don't let somebody put traditional eye medicine in your eye. Don't. When you have problem with your eye, rush to the hospital. And the next thing I'll be talking about is honey. In my hospital, I've seen people who have come there with eyes discharging, having wounds inside, and then they start putting honey. Don't put honey in your eyes. Don't put honey in your eyes. I will tell you, whether you are where there's much honey and you are in the bush, something falls in your eye, and you see the eye paining, wash it with water and rush to the hospital, to an eye clinic. Don't put it. Don't put anything in your eye. Don't put honey in your eye. Yeah. Honey is very sweet. Honey is very sweet for your mouth, and you think that it is sweet for the eye. No, honey is not sweet for the eye. You can put honey in your mouth and you say, oh, since this honey is very sweet for my mouth, the honey will be very sweet in the eye. You're destroying your eyes. The cornea will not accept it. The cornea will not accept it. Don't put even honey in your eyes. And the next thing is breast milk. It's very common. It's very common in the local societies. when they see they put breast milk in their eyes. Very wrong. What is breast milk? Breast milk is food for breast milk is food for the babies, young babies. Breast milk is food for young babies. And when a woman is breastfeeding, it is meant for the baby. It's not meant for the eye. In what conditions do people start putting breast milk in their eyes? I've seen people putting breast milk in their eyes when the eyes become red, especially in the dry season, and they are start having these pursy discharges. These pursy discharges bacterial conjunctivitis. So when you have bacterial conjunctivitis, you go to a woman who is, instead of going to the hospital, you start looking for a woman who is breastfeeding. It is very wrong. Don't put breast milk in your eyes. By the way, bacteria likes milk. And when you put breast milk in your eye, the bacteria will multiply. And it might destroy your eyes, because where you are, there are some bacteria that don't penetrate the cornea, but sometimes you yourself can injure your eye, and it's a different thing. Most patients have come to my hospital with discharging eyes that have been discharging for say 2 weeks, and maybe the whole eye is destroyed. Inside they say they have been putting breast milk. Don't put breast milk in your eyes. It's very wrong to put breast milk in your eyes. So as I was saying, when you have, especially in here with us, see, I've seen people putting these things in the eyes, especially in Africa. Yes. It doesn't mean that in local parts of Africa, not every part of Africa, in local parts, very local parts of Africa, it doesn't mean that they want to destroy the eye. The thing is that some people, especially the patients in my hospital, they stay far in the bush. That is one of the problems. It doesn't mean that somebody would like to just destroy the eyes. No. Some people put traditional eye medicine because they are far in the bush. Before they leave from there to go and look for a hospital, before they leave from there and come to my hospital, they stay far. That's why you see them, they start trying other things. Some people are poor to buy their eye drops. I'm talking the perspective of my hospital, of my own hospital. I'm not talking about everywhere. About my own hospital, where I'm located in a very remote area. Even though I'm located in a very remote area, there are people who still live from further remote areas to come to my own remote area. You can imagine. So when you have bacterial conjunctivitis, when you have pursy discharges, these white discharges coming out of your eyes. A local person calls it Apollo, even though that's not Apollo, but that it locally they call it Apollo. But which Apollo is instead viral conjunctivitis. Since I'm only teaching you about the eye, you are not an eye student. So some local people, they call it Apollo. And some people call it Janjam. They say their eyes have Janjam. So for that reason, you see they start putting traditional eye medicine, especially breast milk. There is a put breast milk in the eye. And when she came to us, I said, but why did you put breast milk in the eye? She said she learned that breast milk is antibiotics. It could be in a way, but not for the eye. It could be a good antibiotics, but not for the eye. So the next traditional eye medicine, which people put in their eyes, are things like you can have tea bags. You put tea. You see, you take tea leaves. Some people take tea leaves, put in water, and wash their eye. It's wrong. You don't wash your eyes with tea leaves. You don't wash your eyes with tea leaves at all. So the next one is saliva. My God. When you have problems with your eyes like bacterial conjunctivitis, you see pus coming out of your eyes, you go to the hospital. I've said the best thing to do with the eyes is to wash out. Don't put saliva in your eyes, because I've realized that most people put saliva in their eyes. Your mouth has a lot of bacteria. Your mouth has a lot of bacteria in a way that when you start spitting in your eye, my God, when you start spitting in your eye, I will go to the extent where even the pharmacists, I'll reach there, don't mind. When you start spitting in your eye, mean the mouth is not really, it's not really clean the way we think. The mouth is not really clean the way we think. And when you start spitting in your eyes, you know that it will cause a lot of problems. And some people put what we call onion. Onion. I hope all of us, I hope we know onion. Don't put onion in your eye. Some say when they start, okay, there's this bacteria, there's this conjunctivitis. Conjunctivitis means inflammation of the conjunctiva. There is this conjunctivitis, we call it allergic conjunctivitis. So we say vernal conjunctivitis. It's common amongst young children, especially the boys. What are the signs of that allergic conjunctivitis? The child tends to scratch the eyes very much, and you see some type of discharges that come from it. We call them stringy discharges. They come long. You can hold it like this. They call it worms. You see, my local people here call it worms. Those are not worms. They are not worms. So when you see those discharges coming out, when you hold it like this, you pick it, sometimes they come out like you think that there are worms coming out. They are no worms. It is they are a type of discharges. Some people start putting in onions. people start putting in onions, which is very wrong. The onion will pain your eye and will destroy your eye. That's another sort of traditional eye medicine. And some people even put, some people go to put bar. I know you know bar from animals, from the gallbladder, from the animal, from the stomach of an animal. You see some people go and put bile in their eyes, which is too bad. When you cook chicken, when you are cooking something like you have some chicken to prepare in your place and you remove that bile, you have to throw it away. Bile from, especially chicken, I know that one is common. Bile from goat, from goat, from pigs. When you slaughter those animals, throw the bile away. Don't keep it and begin to put in your eyes. Don't put those things in your eyes. That's traditional eye medicine. It is wrong. Okay. The next one is some people some people put lemon juice. You know lemon, these fruits. Lemon fruit, some people put lemon juice in their eyes. That is traditional eye medicine. Because when some patients come, you ask them, have you used traditional eye medicine? They say no. Because the only thing that traditional eye medicine is maybe the herbals, the leaves, not only the leaves. When you put onion in your eye, it's a problem. The next thing is welcome, welcome, welcome. So I was talking about so what I was talking again about, you have inorganic substances like oil. No matter the type of oil, don't put it in your. Welcome, welcome, welcome to my life. Welcome. So no, please subscribe. So you can have inorganic substances like oils. An example like soil. You have soil and oil, which people put in the eyes. It's very wrong. It's very wrong to put soil and oil in the eyes. I repeat, you have the cornea. You have the cornea where you are not supposed to. Sorry. Where you have the cornea where you are not supposed to put anything in your eye. So, what are the consequences of putting traditional eye medicine in your eyes? I repeat, your cornea will melt. What is cornea? It is a glass. It is a glass on your eye which you used to see. Many people don't know they have that glass. And so they go and start putting things in the eye. It can cause your cornea to melt. Traditional eye medicine can lead to cataracts. What are cataracts? In your eye, you have a lens, and that lens can become cloudy, blurred, when you put traditional eye medicines in your eye. It can also lead to irreversible blindness. Irreversible blindness, what do I mean? It means that when you are blind, you are blind. For example, here in my local community, we don't have big hospitals where you can go for corneal transplant if you destroy your cornea. If you look on my channel, when you go to my channel, you will see irreversible blindness. I have a video there on irreversible blindness. Go there and check. You will see it. So when you see an eye that has irreversible blindness, means that person will be blind for life. Just so. Okay. So when you come to the clinic already, when you are already blind, we cannot do anything. And what are some of these irreversible blindness? When your cornea has already melted, we cannot do anything again. When you come, you have cataracts and a corneal scar. Yes, they can remove the cataract, but the cornea is damaged. They can remove the cataract, but the cornea is damaged. So traditional eye medicine goes with the cornea. Let's protect the cornea. Let's pray. Please welcome to my live. Like, subscribe, and share. Please like. So now there is one thing we have to talk about is the use of careless eye drops, because there are some eye drops that contain what we call steroids. Steroids. You know, like there are some eye drops that contain things like, they must be prescribed by the doctor. Even if you have a local pharmacy at your place, even if you have a small hospital, small clinic at your place, look for an eye doctor. Because we have realized that people give treatment, wrong treatment to patients. Some patients go to the hospitals and they give them the wrong treatment. That one is worse than traditional eye medicine. I mean, a patient has come to you and you don't know. Instead of you telling the patient to go, you start giving something wrong. It's worse than traditional eye medicine even. So let's know what to do. And then now, why do people put traditional eye medicine? Why do people put traditional eye medicine? The cost of eye drops. Eye drops are too expensive. Not only eye drops, the hospitals are too expensive. The eye doctors are too expensive. And accessibility, they don't easily access, they don't easily have access to the hospitals. They start using traditional eye medicine. I'm in a local area. Before a patient comes, because of the pain in the eye, because of the pain, they start using funny things. And there are some cultural beliefs. There are some cultural beliefs. Okay, for example, you have children, children with measles. Children with measles, their eyes are red. And when the eyes are red like that, you see in the villages, in our local areas here, we start putting in traditional eye medicine. We start putting in funny things into the eyes, and you see sometimes the babies are screaming, 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 and before you come to the hospital with them, you have destroyed the cornea. A child cannot refuse that you should not put something in the eye. A child cannot refuse. You are the one looking for things, putting in the eyes. Yeah. There are other things that can push people to put traditional medicine in their eyes. Trauma. When you sit maybe in front of the eye, in front of your door, you see children in particular, they start playing with sticks, they are playing with knives, they are playing with small, small rubbers, and we are not talking. I have a case which I will put on my channel. You see that case on my channel. I have a case, that child was playing with another child, and they were using sticks. They were playing with sticks. Out of a sudden, the stick entered the eye of the other child. And what happened? The mother went to the farm. When the mother came back from the farm, she just started putting traditional eye medicine. That's all. The eye is completely blind. That eye is completely blind. With others, there is another example of a child again came with from the class, in a class, and the other child used a pen. He used his pen to pierce the eye of the other child. And they took the child to their house, and the mother started putting her own eye drops. The eye drops she bought from the hospital. Now, you don't start putting anything in the eye. One advantage, you who has eye drops already over the other person who does not have eye drop, is the fact that you know the route to the hospital. So take the child to the hospital immediately. Don't start putting your own eye drop in the eye. Okay. Another type of injury is this local bike men. You know these bike men, these people who have okadas, these local okada men. When they want to tie something maybe on the bike, they want to tie a rubber, or they want to tie a bag with a rubber, and then it cuts maybe and stings the eye. Maybe it hits the eye. And what they do is they just jump into the bush, take grass, put it in their, take herbs, put it in their hands, mash it, mash it, mash it, mash it, spit inside, maybe spit in it, and then they squeeze it in their eyes. When you see somebody doing that, you know it's very bad. It's too bad to do things like that. When you want to tie rubber on your bike, or you want to maybe tie something even with rubber, you want to tie, and it enters your eye, or it hits your eye, go straight to the hospital. Don't stay for 4 or 5 days before coming, because most of the times when you come, it is still irreversible. There might be blood inside. There might be blood inside the anterior chamber, which would stain the cornea. And when the cornea is stained, we cannot do anything again. So when you have trauma from maybe tying of things on a bike or in a vehicle, be very careful, rush to the hospital. Another type of injury is nail. I just had one child who came and was playing with a nail, and the nail pierced the eye. Since they are far, they started using traditional eye medicine. As they are using traditional eye medicine, it led to endophthalmitis. And when you have endophthalmitis, it's infection of the whole inner part of the eye. You have infection everywhere. And when that child came to my clinic, what I did was just to maybe start treating secondary infection. You start injecting, you start doing things, but that blindness will be irreversible. It will be irreversible. So let's protect our children from playing with sticks. From playing with sticks. They should not play with sticks. They should not play with knives. Okay. Now, there are some questions people frequently ask, which I'll repeat again. People frequently ask, what is traditional eye medicine? We are saying that, I'm saying that traditional eye medicine is anything, that's my own definition, anything that you put in your eye, which is not from an eye doctor, is traditional eye medicine. A wrong eye drop is a false under traditional eye medicine. When you go to the bush, you cut herbs, you grind them, you put them in your eyes, that's traditional eye medicine. When you go to the kitchen, you take onion, you take honey, you put in your eyes, that's traditional eye medicine. Let's be very careful. So they say, they say traditional eye medicine, especially processed organic or inorganic agents that can be administered in your eyes. Another question is, they say, there's a question, they say, what is herbal medicine? We know herbs, especially with us in our local community here. There are different types of herbs which we put in the, we know guava leaves, mango, we have guava leaves here, we have mango leaves, we have pear leaves, we have leaves from plums, which we easily put in our eyes. We easily grind and put in our eyes. We have amaranthus, we have Venunia amygdalina. All of those things, we put them in our eyes. We grind them, we put them in our eyes. because we think that as we use them for food, we can use them in our eyes. So herbal medicine is things like mango leaves, pear leaves, leaves from any tree, even orange leaves. That's herbal medicine. And there is a question. They say, what leaves can you put in your eye? Don't put leaves in your eye. You can only eat. You can only eat something which can be healthy to your eyes. Don't put it directly in your eyes. You can only eat something which can be healthy to your eyes. And what I can you eat? Healthy eyes for best vegetables for you to eat. The best vegetables for you to eat. You have carrots. I hope you know carrots. You have broccoli. You have garlic. You have green peas. It depends on what is found in it. All green eatable leaves are good for your eyes. Okay. Somebody asked a question there. What's the best medicine for the eyes? The the best medicine for the eye is the disease, the medicine that can treat the disease that you have. Because there are different medicines for the eye. There are different type of medicines for the eye. Depends on the type of disease that you have. So if you have, if you know some of the eye diseases, like glaucoma, there are eye drops for that. You know conjunctivitis, there are eye drops for that. So the best medicine depends on the type of okay. Somebody asked a question. They say, what can heal the eye naturally? Good nutrition, good diet, where you take good food. And what is good food? I did not say rich food. We in the local area, we have our palm oil which we can eat. We can eat other things that will make our eyes healthy. Okay. There's a question, somebody is asking a question there that what are examples of traditional eye medicine? I already said it long. I said, let me repeat, all leaves are traditional eye medicine. All these leaves that you see outside there, you have mango leaves, you have pear leaves, you have leaves of guava, you have leaves from every other leaf. When you grind it and put in your eye, a traditional eye medicine. And I would like to tell you that if you go to the pharmacy and you take the wrong medicine, that's traditional eye medicine. Means you are treating from tradition. That tradition, treating it traditionally. You're not supposed to put that out in your eye. Go to an eye doctor. Prescription from an eye doctor is the best medicine. When you go to the farm, you have injury, wash your eye with pure water. Don't put anything inside. Yes, somebody say, what plant is good for eye problems? What plant is good for eye problems? We say you can take spinach and green leaves, all green leaves, especially the ones rich in both vitamin C and vitamin E. They will also have carotenoids. For example, you eat things like carrots. We eat things like carrots to help you. There's somebody say, how, how can we improve our eyesight naturally in the home? Okay, I was talking here about traditional eye medicine. Don't put anything that has not been prescribed by the eye doctor in your eyes. Don't put it. Go to the eye doctor. Go to the eye doctor. Lay your complaint, and they'll give you the right treatment. Don't have problem, foreign body entering your eye. You jumped to the pharmacy, to the maybe the local pharmacy in your place, and then you just buy anything and you start putting in your eye. No, go to the eye doctor. There is no help. There is no help that they say they just put that in your eye. No, I cancel it. Cancel that talk. Okay. They say, somebody is asking me a question there. What helps an eye to heal faster? Okay. What helps your eye to heal faster? One, when you go to an eye doctor faster, your eye will heal faster. Number two, the instructions from the eye doctor, very important. What instruction does the eye doctor give? The eye doctor can tell you, put your eye drops 3 to 4 times a day. And then, when we say 3 times a day, we say 4 times a day, it could be 3 hourly, every 3 hours. Do it. The eye doctor will teach you how to use, to clean your hands before using the eye drops. Never you open your eye drops without washing your hands. Wash your hands before you open your eye drops. And you don't touch the tip of the eye drop. You don't touch the tip of the eye drop. When dropping, you make sure that the tip of the eye drop does not touch your eye and your hand does not touch it. My next video, I'll teach you how to instill eye drops. I'll teach in my next video how to instill eye drops yourself. Because sometimes some people go to the hospital, they are alone, and in a local hospital, in my hospital, we could be occupied, and then they teach you how to use your eye drops. How can an eye heal first? Instructions from the eye doctor on how to use the eye drops. It's very important. Somebody is asking question, what are the different types of traditional eye medicine? As I was saying, the different types of traditional eye medicine. You have leaves. These leaves, these are our local leaves. You have, what are leaves? Our local leaves, you have pear leaves, you have apple leaves, you have mango leaves, you have orange leaves, you even have these small grasses that are growing on the farm. there is a type of grass, the grass that they call damage. Most people, you know what? I've noticed it that this particular grass, there's a type of grass called damage. I'll come and show you the different type of grasses. I'll do a video on that. I'll show you the different type of grasses that people just take and they use it in their eyes because maybe they have been putting it on their legs. Maybe they have wound. When they have wound on the skin, they put it there, maybe it helps. And then you take that same herbs, you take the same herbs, you put them in the eye, you are destroying your cornea. And as I started saying, the cornea is like a glass. It's like a glass. When it cracks, that's all. When it breaks, that's all. I am a cataract surgeon in a local setting. I don't have the rich facilities. What I can easily do is I do cataract surgeries on the poor people. I treat the eyes of poor people, people who cannot afford much money. And so the best thing I've realized is to teach them. Because if I start teaching them what to do, prevention is better. So I realized that people come to the hospital, they've used all these traditional eye medicines because of lack of knowledge. What is the use if somebody comes with a cornea that is melted? What is the need? What are you going to be treating? You cannot treat anything. So somebody say, what is the most powerful herb to put in the eye? Don't put you any herb in your eye. Don't put you any herb in your eye. I've given you example herbs. Trees and grasses. Grasses and trees, the different type of grasses and trees. There's a type of grass people call damage. Damage is very common around here. You can put damage in the wound on your leg. You can put damage, the wound on your hand, even the wound in your mouth, you can put damage. But in the eye, don't put any herb. That's traditional eye medicine. Don't put it. It is very wrong. Welcome to my life. Please subscribe. If you have not subscribed, please subscribe. They say, oh, what is the home remedy? Somebody says, when I have a problem, maybe on the farm, somebody is asking me a question. When I have problem, maybe on the farm, I go to the farm and I have injury, what should I do? For example, so a foreign body falls in my eye. The first thing you have to do is to wash with water. Wash it with water. When you are going to the farm, you even have water in a bottle. Open it and wash your eye. The next thing is, don't rub the eye. When we talk of rubbing the eye, don't rub the eye. Because if there is a small stone in your eye, you yourself, you use that stone to scratch your eye. And when you use that stone to scratch your eye, the next thing is to start putting herbs inside. When you put herbs inside the eye, that is fungus. That's fungus. And when you put fungus inside the eye, that's all. To treat fungus here in my local community, it's untreatable. You cannot treat it. You scratch the eye. You put herb. You start putting herbs inside the eye. Fungus gets the eye. That's all. The next thing, they say what helps treat the eye. Again, I will say there is no herb that treats the eye when you put it directly inside your eye. There is no herb. That's traditional eye medicine. Go to the hospital. Unless you are eating, you can't eat. Can't eat anything. But don't put it inside your eye. Don't put it inside your eye. When there are herbs, you can eat the herbs, but don't put it in your eye. The next question is, somebody says, somebody says, how do I cure, how do I treat a blurry vision at home? Again, this question is coming up because people want to use traditional eye medicine. No. You cannot treat blurry vision at home. When you have blurry vision, come to the hospital. There are so many things that can cause blurry vision in our local community. But when you are found in a community where there are the facilities, okay. In a local community where you have blurred vision, there is nothing as treating blurred vision at home. Come to the hospital. Somebody say, how do I get my eyes back to normal? Come to the hospital with the eyes. If you want your eyes to be normal, don't use traditional eye medicine. And what is traditional eye medicine? Traditional eye medicine are the herbs that we use to treat our eyes. And what are herbs? You have trees, leaves of trees, grasses. We take them, we grind them, we start putting them in our eyes. Some of those things, they are not good for the eyes because of the chemicals in the leaves, the chemicals in the herbs. They can easily destroy your cornea. And what is your cornea? Your cornea is the glass. It's like a glass in your eye. No, you have something like glass in your eye. Don't use any herbal medicine in your eye. Somebody is asking me that somebody is saying that what type of plant can heal. There's no plant that can heal the eye when you have an injury. Go to your hospital, go to the nearest eye hospital. Like here, I'm nearest eye hospital to so many local communities. Come to our eye hospital, come to my eye hospital. Thank you very much. Thank you for joining my life. See you tomorrow. Bye-bye.